Good to go.
Good
All
to go.
right. All right. Welcome, welcome. I am so excited to present today's Root U. My name is Dr. Fadwa Gillanders. I will show my slide in a moment. But we thought what a great idea since the last Tuesday of the month to honor breast cancer. And it hasn't been talked about in quite a while on the Root U's. And I've been given the privilege truly to sit in for Dr. Rahm today. Normally the formulator, if you're not aware of who she is, Dr. Christina Rahm. She is the formulator of Root Brands. And of course, do my arrows here. And I'll mention her in a little bit more, but she normally does the Root Use every single week. And it's really quite an honor to have the actual formulator do the Root Use. And so I'm really excited to be able to do that. Medical disclaimer. One moment. I gotta fix my medical disclaimer is covered by Zooms. And I can't seem to, there we go. I think that's better. All right, the medical disclaimer. The information provided is for educational purposes and is not intended as medical advice or a substitute for medical advice of a physician or other qualified healthcare professionals. You should not use this information for diagnosing a health or fitness problem or disease. You should always consult with a doctor or other healthcare professional for medical advice or information about diagnosis and treatment. We do not claim to treat, diagnose, mitigate, prevent, or cure disease in this presentation. I also want to thank Tiger for putting the slide deck together. And it actually was her suggestion for breast cancer. So thank you, Tiger, for the opportunity and such a beautiful slide deck. She did an amazing job. This is Dr. Christina Rahm. Like I said, she usually does the Root Use every week. And if you don't know who she is, I did invite some other guests here, and I know some other ambassadors might have guests here that don't know who she is. She is the CEO of DRC Ventures and Chief Science Formulator at the Root Brands. She actively supports philanthropy through the Rahm Foundation, partnering with nonprofits to make a difference worldwide. She has advanced degrees and certifications in the field of nanotechnology, pharmaceutical management, nutrition, and philosophy. Dr. Rahm has lectured globally, including at the Vatican. She's developed 18 patents. She has some patents that are pending, but she currently has 8 approved patents, US patents. And she is one of less than 7% of women worldwide that actually have patents, at least one, and she has 8, and many more that are pending right now. Numerous proprietary formulas and authored 7 books, such as Cure the Causes series and recent work on military science. And this is me, Dr. Fadwa Gillanders. I'm a clinical pharmacist. I have 25 years plus experience in adult internal medicine, metabolic syndrome specifically, and I have 20 years self-taught in functional medicine and now entering into the biohacking cellular nutrition realm, and it's been amazing. Did I go too fast for the translators? Everyone doing okay?
Yeah, you're great.
All right. I'm sorry. I'm having problems with the I can't seem to move the, let me see if I can move it over here, get out of the way. Here we go. Breast cancer is a type of cancer which originates in the cells of the breast tissues. It typically forms in the lining of either the milk ducts or the lobules, which are glands that produce milk. While breast cancer primarily affects women, it can also develop in men, though this is much less common. Breast cancer starts when normal cells in the breast begin to grow uncontrollably, and these normal cells form a mass called a tumor, which can either be benign, non-cancerous, or malignant, cancerous, and have the potential to invade nearby tissues. They can also metastasize through the body's lymphatic system, which is one of the largest organs in our system with detoxing, or blood vessels and reaching distant organs. There are 3 common types of breast cancer. There's ductal carcinoma in situ. This is a non-invasive form of breast cancer, and it's rare to find it. It's pretty much like right on the surface level of the cell, and you don't develop a lump yet, so it's hard for women to feel it. But when you can catch it, it's a great opportunity to get rid of it, and you have a greater success rate with dealing with the breast cancer. Invasive ductal carcinoma, the most common type of breast cancer, begins in the milk ducts, but breaks through the duct walls and invades nearby breast tissue, and it can spread to other parts of the body. And then we have the invasive lobular carcinoma. This type of cancer starts in the lobules, milk-producing glands, and can spread to surrounding tissues. It's the second most common form of invasive breast cancer. What I feel is when I was working on the slide deck and doing some research and studying and preparing for today, I was studying on mitochondria. We're going to be talking about a product that helps with mitochondrial biogenesis, meaning the creating more mitochondria in your body, in your cells. And I came across Dr. Thomas Seyfried. He's an expert of cancer and mitochondria, and he studied the work of Dr. Otto Warburg. He's a German physiologist. He is the only one that had received a Nobel Prize for physiology or medicine in 1931. I kind of thought to myself, maybe that'll be Dr. Rahm next. But Dr. Warburg's theory was that cancer is primarily more of a metabolic issue than actually a genetic issue. And it's due to the energy deficiency of the cancer cells. So basically, cancers arise from cellular respiration. Did you know that we actually breathe through the mitochondria? Sometimes we think of only our lungs as a form of breath, but actually it's the mitochondria that makes breath for us and respiration for us and helps to control energy consumption in our body. Our body wants to conserve energy as much as it can when it's dealing with oxidative stress, free radical damage, removal of toxins, digestion, and so forth. But what happens with these cancer cells is that through this energy, cancer cells can grow with anaerobic, with no oxygen, and they actually grow with fermentation, and that happens with glycolysis, a breakdown of sugar. And so that's why a lot of times physicians will tell patients to avoid sugars when they're dealing with their cancer and cancer treatments, because you want to suffocate the cancer. And so Dr. Thomas Seyfried took Dr. Warburg's theory and kind of expanded on that. He has publications, you can find them on PubMed about this. And I want to show you. So basically, the normal cells use oxidative phosphorylation, which happens in the mitochondria inner membrane. I'll show you a picture of that in just a moment. This is the aerobic respiration. This is where we make energy. This is where we breathe. But when that oxidative phosphorylation pathway is disrupted, and now you start to suffocate it, now you see growth for the cancer cells, and they grow outside of the mitochondria. So let me show you this. I found this very interesting. Lost my cursor. Here we are. So here's a healthy cell versus unhealthy cell. So the healthy cell will break down sugar in the cytoplasm of the cell outside of the mitochondria, create something called pyruvate. Get the laser pointer. Create something called pyruvate, and then that ends up going into the Krebs cycle. And this is where we use NAD cofactors for energy to make ATP to breathe and create more healthy cells. But what ends up happening here is through the glycolysis, the breakdown of sugar, the unhealthy cells start to feed off here and start to make lactic acid, the fermentation of sugar. And therefore, it cannot get into the Krebs cycle, and you can't make appropriate ATP. So this is where most of the energy source is coming from, is outside of the mitochondria. And so we want to starve those cells. One way of doing that is called ketosis, putting yourself in a starvation mode, letting your intermittent fasting, eating more fats, healthy fats. And we have some products that also will help with ketosis as well. But I found that so interesting. If we look at the genetic side of the causes of breast cancer, we have BRCA1 and BRCA2 mutations. BRCA1 seems to be the more severe of the two of them. It's usually associated with something called triple negative cancer, which means the three receptors for hormones, estrogen, progesterone, and HER2 are not available. And you only have immunotherapy or monoclonal antibody treatment to deal with BRCA1. And BRCA2 is the most common form. That's usually the hormone-related component cause of breast cancer. Hormonal factors are early menstruation or late menopause due to the prolonged exposure to estrogen, and the early onset of menstruation or late menopause. So you use also hormone replacement therapy like birth control or estrogen post-menopause can also be a risk factor. And then we have the environmental risk factors, which would go hand in hand with the metabolic theory of Dr. Warburg, such as obesity, alcohol consumption. Alcohol is huge in causing an increase of estrogen levels and speeding that up, and having a greater increase of menopause, which will also put you at risk for breast cancer. Sedentary lifestyle, lack of physical activity is associated with higher risk for anything, as well as cancer. Radiation exposure to ionizing radiation, particularly during childhood, can increase breast cancer risk, and certainly endocrine disrupting chemicals. So, phthalates, I was trying to pronounce it before I got on. Um, Sorry, I just saw something. Uh, BPAs, basically metals. And this is probably where more men get the risk of breast cancer due to metals and mimicking an endocrine um, process system in our body that is not natural, not natural testosterone and natural estrogen. Breast cancer risk factors, well, gender. Breast cancer primarily affects women, although it can affect men, and usually by age, the over age of 50. And I really think that the greater age is, or the Yes, the greater age is due to the fact that you're making less mitochondria as we age. So one of the secrets to reversing age is making more mitochondria. Mitochondria is what keeps you young. Collagen is what keeps you young. Also, when we age, we make less collagen. I will be addressing that later. And so I really think when you don't have the powerhouse organelle as your backbone to help you fight some of the attacks of the unhealthy cells, then you are more at risk for anything, cancer or diabetes or heart disease. Bisphenol, BPA, endocrine disruptors I just mentioned, environmental exposures, and pollutants. Some breast cancer treatments, we have surgical options, lumpectomy, the procedure to remove the tumor along with a small margin of surrounding healthy tissue. Mastectomy involves the removal of the entire breast and sometimes nearby lymph nodes or other tissue, because the lymph nodes are like located underneath your armpits. And if you don't get rid of those, they'll go and metastasize around the body. Radiation therapy, the purpose of it is often used after surgery, especially a lumpectomy, to destroy any remaining cancer cells that may not have been removed. It helps reduce the risk of cancer reoccurrence. And we have chemotherapy, using drugs to kill cancer cells throughout the body. It can be used before surgery to shrink the tumors or after surgery to eliminate any remaining cancer cells. Okay. So if we look at the treatment, some additional approaches for breast cancer, as we mentioned, breast cancer is dealing mostly with hormones, estrogen. And so the purpose of hormonal therapy is to try to block the estrogen receptors and not stimulate them anymore. So we can kind of shrink those cells and they will stop replicating. So we can use things like selective estrogen receptor modulators like tamoxifen or aromatase inhibitors. And then we can also do targeted therapy. The HER2 targeted therapy is an epidermal growth factor receptor. It actually has another name they're going to be using called the ERBP2. And basically, it's a conglomeration of tyrosine kinase enzymes. And these tyrosine kinase enzymes are a class of enzymes that are in cellular development and growth, but their level is elevated with breast cancer. So that's the targeted part, is getting to that tyrosine kinase and stop it from replicating the cell. And then we have immunotherapy. And really, when we look at immunotherapy in conventional medicine, it's used really as a last resort for all sorts of conditions. Because what ends up happening is that your immune system is constant, it's really an alert system. And it's alerting the body that it needs help, that there is a problem. Mostly it's trying to target the mitochondria to stimulate and bring reinforcements. Like mitochondria helps function with apoptosis. It is the primary function of cell death, to help promote cell death of unhealthy cells. So when you suppress the immune system, the goal is to quiet down that noise, and hopefully the body will try to heal itself. What ends up happening is that you get this cycle that ends up occurring. You quiet down the noise, the unhealthy cells might be suffocated for a little bit, but whatever's left will start to replicate. And then before you know it, the immune system will come back and be, angry again. And you end up having to up the dose of these immunotherapy medications. So So the side effects of chemotherapy in breast cancer, it's a common treatment for breast cancer. It can lead to a variety of side effects. Hair loss is very common. I'm sure many of you know about that. Nausea and vomiting. These chemo drugs are so harsh on the cells. You get gastritis, irritation of the stomach lining, intestinal tract, a great deal of fatigue just from the cell death itself, as well as just targeting the other organs that are compromised. Increased risk of infection. Chemotherapy definitely lowers your white blood cell count. So most patients usually have to stay home. They can't go out in public because they're very high risk of getting an infection. Neuropathy, nerve damage. Some chemo agents can cause peripheral neuropathy, numbness in your hands and feet, changes in appetite and taste. You'll have something called like chemo brain. The long-term effects that kind of linger even after you're done with your protocol with your chemo treatment. You start having some, brain fog, chemo brain, they call it. Heart and lung problems. Drugs may have long-term effects on the heart and the lungs, leading to complications, risk of infertility, um, and increased risk of secondary cancers for sure. So how do the root products can impact breast cancer and chemotherapy side effects? So here we have, before I even go through the products, again, this is no medical advice. This is for education and entertainment purposes only. But I do want to take the time to discuss the concept of ingredients. As I was going through the slide deck that was so beautifully made, I was telling myself, we have a tendency to just list the ingredients and talk about them and how they help. But I don't think we really appreciate how these products were made, which is really more important than the listed ingredients. Because you can go off, to any health food store and look at a bottle and see the list of ingredients, but you honestly don't know how they're made and where they're sourced. And that needs to start becoming the language and the habit of how we become smart consumers. When I would work with my patients and they would ask me, hey, I want to purchase a supplement, I would teach them how to read a label, what to look for. And even in the last 4 years, I'm learning and elevating my ability to go even deeper with what these products mean, when you're shopping, to be a smart consumer and an investor of your health. So Dr. Rahm has patent technology and patent pending technology on these products. She also has trade secrets of her sourcing. But she uses a technology to clean out her plants, the seeds, the beans, whatever she uses to make these products, they are cleaned out because, as you know, our food, our plants are just heavy laden with toxins. And so even if you use a plant, if you don't clean it out, it's filled with toxins. And to prove that these products are clean is that this company has been able to get the BSCG blue certification. It's banned substances and controlled group. And most nutraceutical companies get the yellow seal. The yellow seal allows you to use it in athletic sports because there's no drugs in it or contaminants in it. But to go above the yellow seal, to include that yellow seal and get the blue seal of quality, is telling you it's 100% non-GMO, no pesticides, no contaminants, and organic. So that's clean. What do you think about that? So these ingredients are actually up leveled to their purest quality and their functionality to be used in the body as food for the cell. They are microdosed, proprietary blend to be used together as food for the cell so the cell can be activated, fed, and start doing what it knows best in terms of healing the body. The flagship product that we have here is Clean Slate. It's bioavailable silica from a zeolite called clinoptilite. Clinoptilite is a crystal. When you break it down and fracture it, it becomes bioavailable silica. And there, if you look up in PubMed on clinoptilite, I just did it just before I came on to make sure, there are a plethora of studies showing clinoptilite in terms of a therapy modality for cancer. And it's becoming so popular that there are synthetic data out there looking how they can make it from like cotton or China clay or what have you. But this particular product is pure clinoptilite. It's not synthetic at all. And it's fractured down, broken down into ortho bioavailable silica. So what it does, it pulls toxins from the body, any toxins, metals, parasites, pesticides, and at the same time simultaneously regenerates the cell. You don't want to just pull from the cell, let the cell collapse, and not regenerate it with silica, vitamin C, and trace minerals so it can get that electric charge back again, wake up again, and start doing what it knows best. The next product is Restore. This is an amazing product. It's microdosing, a nanoemulsion of various ingredients. The top ingredients that we'll mention here are black seed oil, resveratrol, turmeric, aloe vera, and D-ribose. Every single one of those ingredients have studies in the already documented and their correlation for tumor cancer benefits, mitochondrial benefits. Black seed oil helps with inflammation. Remember, when you're dealing with cancer, whether you're doing treatment or you decide to go holistic and take care of it on your own, whatever the case may be, your body is under stress. It's under a lot of inflammation and oxidative stress. So black seed oil helps with that. Resveratrol is an antioxidant. It has anti-cancer properties, inhibiting the cellular cancer cell growth. Turmeric, tons of studies on turmeric. It contains curcumin. Dr. Rahm uses a curcumin extract in this Restore, which may reduce inflammation, oxidative stress, and also has studies with cancer. Aloe vera and D-ribose can support cellular repair and energy production. Believe it or not, D-ribose, although it's a sugar, there's a lot of studies supporting its role in mitochondrial biogenesis as well as anti-tumor suppression. Zero in. This is our nootropic. It also has benefits of curcumin, pine bark extract, vitamin D3, lots of studies with vitamin D3 in cancer research, and N-acetyl L-tyrosine and L-theanine. So zero in, the concept of this particular nootropic is that, again, it's a proprietary blend. All the ingredients are stacked up against each other, working together, complementary for each other. We hear about the concept of gut-brain axis, right? The gut brain, your gut is the second brain. And this zero in actually proves why that is true. We have a vagus nerve, the 10th cranial nerve of our body, that goes from the brain through the chest cavity and into the abdominal space. And so this zero in works in the intestinal tract, and it's picked up by the vagus nerve, the blood flow of the vagus nerve, to go to the brain and convert to dopamine and serotonin. So it helps with mood, focus, and energy. And those with cancer, we just talked about chemo brain fog. Zero in is a great benefit for those patients. Helps get you out of bed. ReLive Greens. Dr. Rahm is a cancer survivor herself. She's had 2 major cancers in her life and Lyme disease as well. And she was able to help get rid of her cancer by going on spirulina and a green drink that she drank. These are years past. And so this formulation is based on her experience and her love for knowing the benefits of greens put together. What is also interesting about this particular product is she has algae in this product, the spirulina and the chlorella. We also have algae, phytoplankton, in a cream that we have called Reno. And also another product I'll mention to you here. I was doing some research on algae, and that's also becoming a very big therapeutic point for the medical industry. They're really looking into algae and, of course, finding synthetic ways of creating the benefits of algae. But again, nothing here is synthetic. These are pure algae, chlorella and spirulina. They deal with detoxifying. ReLive Greens also helps with that ketosis to help suffocate those cancer cells. That's the concept of it. It has broccoli, kale, spinach, aloe vera, flaxseed. It also has MCT oil. Again, MCT oil really helps with ketosis as well. So these greens help with detoxing, boost the immune system, give you some pre and probiotics in your gut to help with that nausea and vomiting that they might be dealing with, and refeed your body. Immune defense shield. So this is our product that helps with mitochondrial biogenesis, helps you make more mitochondria, give energy to the mitochondria. It contains quercetin. Quercetin helps increase cellular NAD. NAD is a cofactor in the Krebs cycle. It's also a cofactor used in producing glutathione. And so this product is definitely a must for anybody that's going through any form of oxidative stress, removal of free radicals, and reversal of aging. Remember, as you make more mitochondria, you actually reverse aging. If we think of what happened 4 years ago, those that were most at risk with the flu were those with diabetes, obese, and the elderly. And that really has to do with the fact that they didn't have as much mitochondria to handle the symptom attack of the flu than those that were younger. So this product is a must-have. I take it every day, and because I want to reverse my aging, I want to be able to handle whatever comes my way. And this is a great opportunity for those with cancer to consider with their treatment or post-treatment. Collagen. So when I was doing my research, there isn't any studies for direct, collagen and anti-tumor or anything, to lower cancer progression. But what is interesting about collagen, and I'm not sure if you know this, it's actually your second immune system. So we have a primary immune system, we have an innate and adaptive immune system, but collagen is kind of the backside of it. Not only does it help prop up your skeletal muscle, keep your skin taut, but it also helps to ensure that the immune system is working well. It acts as a drone, and there's pieces of collagen that will just come out and kind of fly over your immune system and making sure things are working well. If there's any issues going on, it will go and target other cells to bring reinforcements. Also, as we age, we reduce our collagen production. So this collagen is a pure form of bovine collagen as well as colostrum. Colostrum, as you know, is the first few days expression from the mother's milk when she's breastfeeding her baby. It helps set the gut for the baby to help seal it and prevent any leaky gut. And it has immunoglobulins within the colostrum. So you have these immunoglobulins, especially if you're dealing with leaky gut, all of us are to some extent. And so you can kind of like reset that back for as if you were a baby in some ways. And it pairs nicely with the collagen as we're dealing with inflammation, the reduction of collagen as you age, you go and replenish that and help activate your current collagen synthesis. So collagen plays a very big role in more of an indirect way. And Crush. This is our amino acid peptides uh, product. It helps produce glutathione, the master antioxidant. It's so important to help keep supporting your body's ability to make its own glutathione. So I showed you immune defense shield is one way of doing that. ReLive Greens is another way of doing that. And we have Crush here as another way of doing that. It contains milk thistle to support liver detoxification. Your liver takes a big hit when it comes to medications, a big hit when it comes to even the environment and toxins in and of itself from food and so forth. But medications, the only way medicines can turn on, and it has to go through the liver. And the liver has multiple enzymes. We call them P450 enzymes that the drug picks a path that it pairs with, and that path turns on the drug, and then the drug goes into your system and starts doing what it's supposed to be doing. And so it's really important to harness and give the liver the support that it needs as it's dealing with these, chemicals and medications coming through it. And so Crush is great. It has a microalgae called tetrasod, and tetrasod has a lot of studies on muscle production, energy production, and it increases glutathione because it has an enzyme called superoxide dismutase of over 300%. This is also, if you do some research on tetrasod, you'll see a lot of nutraceutical companies really want to get on board with this particular algae, but you have to source it well. And so some of them are, again, looking into synthetic means of kind of copying the tetrasod potency. I feel like I'm going too fast. Hopefully not. Let's see where I'm at. It's like my last slide. Clean Spirits. This is a very special product. It has, I think the patents are on this one too. 5 patents on Clean Spirits, I believe, have been approved so far. It has N-acetylcytosine, which is a precursor amino acid in making glutathione. It's great for supporting liver detoxification, especially as I just mentioned before from cancer treatments. It has zinc and vitamin C. So it's kind of a spinoff from Clean Slate. It has the foundational technology that's in Clean Slate, but also additional components add onto it, like the NAC, the zinc and the vitamin C. Um, the concept of clean spirits is twofold: detoxing, number one, but number two, to help upregulate those enzymes that I just mentioned to you about, the P450 in the liver, to help increase metabolism and breakdown of, the medications, any opioids, and any addictions like alcohol addiction, opioid addiction. These enzymes get upregulated with clean spirits to help get them out. I don't know if you know this, but with alcohol specifically, it takes 10 more steps for your body to remove alcohol. And it will remove alcohol first before it'll even go into digestion for your food. So if you're eating like a meal, you have a glass of wine, the body will try to get rid of the wine first before it will digest your meal. So clean spirits helps to upregulate those enzymes to kind of help with that metabolism process of alcohol. Opioids go through the same system, same process as well. And it also helps with mood, helps with, works really well with zero in dealing with cell trauma, emotional strain, and what have you. So this is definitely a very special product. Um, and it's my last slide. So any questions? Did I go too fast? This was really a fun topic.
Dr. Fadwa, do you want to expand a little bit on the correlation of putting the body into ketosis, why that's so important, and the formulation of Sculpt
Oh,
and the correlation between the two, and how a lot of people that get the diagnosis, and even just with cancer in general, automatically should look at their sugar intake and potentially looking at sugar. So do you want to, I know that there's a lot to unpack there, but I think that would be a good place to start to kind of create a conversation.
yeah, let me go back to, that's weird. Why do I have two of these open? Excuse me. Let me go back to the beginning, or not to the beginning, but to the picture. So we don't have this, I don't have a picture of Sculpt on here. That's another product. Um, Let me go back to this picture here. So let's first talk about ketosis, and then we'll go into Sculpt. So the reason why ketosis is so important, if we look at a healthy cell right here, oh, let me get the light, let me get the laser. And you see how much energy you make here? This is ATP. And most of the healthy cells want to go through this Krebs cycle all the way through the mitochondria and produce energy, respiration for the body, and make ATP. Now, this Krebs cycle here uses our nutrition. It uses carbs, proteins, and fats to break it down and produce the energy. But what we found was when you eat only fat or more fat than carbs, your body actually makes 135 ATPs. If you were to break down just carbs, it only makes about 35 ATPs. So our bodies actually love fat for fuel. And so ketosis is a way to kind of use your fat sources that's already in your body with intermittent fasting, and it'll go into those fat sources as a form of energy. It'll deplete your glucose storages first from your
Mhm.
muscles, from your liver, wherever in the plasma that you couldn't get it to store because of insulin sensitivity, insulin resistance. And then once those are depleted, it'll go into the fat storage and start using that for energy. And that's why those who are in ketosis they have clear brain. You start making beta hydroxybutyrate. I forgot to mention that in crutch. You start making beta hydroxybutyrate. You start making energy. You have clarity in your brain, and your cells are like loving this. It's the fuel they prefer, and so that's what ketosis is. And with the unhealthy cells, with the cancer cells, they, if you don't change your diet or suffocate them, stop the sugars, stop the carbs, and you keep eating that way, like I said, with insulin resistance, you have all this excess sugar hanging out, you have sugar in your muscle cells, um, and your body's using that first for fuel. the cancer cells will feed off of it, and you end up having an anaerobic environment, a non-respiratory environment, and you pretty much end up suffocating the mitochondria. And this is
Mhm.
all fermentation, all lactic acid right here. And so look at so here you're making energy on this, it's called the substrate level phosphorylation. You're making energy here, but that's not what you're supposed to make energy here through the mitochondria. So you're suffocating the mitochondria, you're suffocating your fuel source, your powerhouse organelle that helps reduce oxidative stress, help preserve your healthy cells that you have, and help direct apoptosis, the killing of cells, specifically the unhealthy ones. And so that's the importance of ketosis. Now we don't have, let me just stop this here. Let me get back so I can see everybody. We don't have Sculpt. I didn't have a slide for Sculpt, but that's another product that we have that goes beautifully with Crush. Sculpt has about 6 ingredients in there, and it targets 5 to 6 different pathways in our body to help with the metabolic syndrome deficiencies. So when you can't have store properly sugar, break down sugar, store fat, break down fat. Your gut is leaking glucose, so we can't, we want to be able to stop and slow down breakdown of glucose in the gut. So all these areas Sculpt goes and targets. So these cells could eventually start talking together. And so you can have proper glucose storage, break down fat, and so forth. And so that's the beauty of Sculpt. Really, almost anyone should be going on Sculpt.
I've
Whether
been looking at it for me, and I originally was like, "Oh, I'm never going to use this," and I've been entertaining the thought of me starting to take it. I've yet to try it, and so that was one of the reasons I wanted you to talk about it because the injection of that into the daily regimen for somebody potentially even with a cancer diagnosis, it could just do nothing but help support.
absolutely, absolutely. Yeah, 100%. So all the other products that I talked about play a role in metabolic syndrome, and I was trying to identify that, especially with ReLive Greens. But Sculpt is just another game changer in terms of targeting these 5 to 6 different pathways in our body. If you only target the gut, then the other, you got these large fat cells that can't store any more fat, and they're not getting any proper signaling. And then the same thing with the liver, it's thinking that you need to make more sugar because you got all this other sugar that can't go in and store the whole mess. So Sculpt goes and helps balance that noise, but it takes time. Give yourself time with balancing that noise. And just as a side note, because Sculpt was launched as a weight loss product in some ways, and I've come to the conclusion that obesity is really a symptom of a metabolic syndrome issue. So when you balance the metabolic state, the weight will come off. You
Hmm.
know, you can't be diagnosed with anything until you see it. Your doctor can't diagnose you, he can't say you're overweight unless you show it on the scale. Well, if you're overweight, that means there's something going on behind the scenes, right? It has to do with your diet or sedentary lifestyle, or you're having trouble losing weight. There are a lot of women that are like, man, I've been on the working out, I'm not eating, and I just look at cake and I gain 5 pounds, and that just has to do with an offset metabolic state. And then pretty soon you can look at cake and lose 5 pounds. But once you start taking Sculpt.
Awesome. While you're finishing up, can you re-show the reference page? There's been a couple people asking
Oh,
for that,
sure.
that
Sure.
wanted to take a look at that. And
Absolutely.
then do you want to also discuss um, potentially maybe if somebody was to come up with this diagnosis? I know that this is a very common, cancer. Obviously, we're finishing up October. Um, Maybe diet, right? And I think you went in depth a little bit, but maybe potentially some diets that could help benefit. I know Tiger and I constantly talk about carnivore and that obviously is a high protein, also fat, but helps the body get into ketosis. There's intermittent fasting, maybe some options that somebody might be able to give somebody if they come across somebody or if somebody in their family or God forbid them come up with a diagnosis similar to this, like what's something that they can do in just their box of home or their kitchen, like what's an impact that they can make?
Absolutely. I'm really glad you mentioned carnivore, especially in light of cancer. So one of the debates with cancer is not using a branched chain amino acids as a supplement and lowering your intake of protein because it contains amino acids. And the debate, the reason why that is the debate is you're feeding the cancer, like you're giving it fuel. But Dr. Thomas Seyfried, and I didn't want to mention it only because I just didn't want to go off on a tangent, but since you asked the question, Dr. Thomas Seyfried said that there's two fuel sources that the cancer feeds on. I mentioned one, sugar, and it ferments sugar, but there's an amino acid that also the cancer can ferment, and that's glutamine. And it's interesting that of all the amino acids in crush, glutamine is not included.
Mhm.
And so that's pretty cool. That's number one. Number two, you get glutamine a lot from beef. So it's one of the amino acids that are in beef. Now it's a non-essential amino acid. We don't need to eat it to fuel ourselves. Our body makes it on its own. And so one of the things you want to do is starve that, you want to continually remind yourself, I need to starve this cancer cell. So you starve it from two sources, sugars and glutamine. And so if you can intermittent fast at least 12 hours a day, and then go on, ReLive Greens or Restore to help feed your cells and give yourself more high fats like grass-fed butter, coconut oil, avocado oil, and lean meats. If you have to do, excuse me, sorry, I lost my train of thought. And not go too high on the proteins. So more of a fat to protein, like a 3-to-1 ratio or a 2-to-1 ratio would be the best way to go. And there's another component to include in your diet is cottage cheese. Dr. Johanna Budwig actually has a cottage cheese protocol that she used for cancer back in the day. And if you have cottage cheese and flax seeds, the whole flax seeds, not ground, and you eat that together, is also really good to fight cancer. So cottage cheese, high fat, intermittent fasting, just keep asking yourself, how can I starve this cell? How can I starve this cancer? So you know that it feeds off of sugar. So anything that's going to make sugar is what you want to avoid and lower your intake of protein. Don't go, especially when it comes to beef.
Yeah. Just to reference some individuals in the chat, we've done a breast cancer case study with ISNS.
Yes.
So for those of you who are ISNS members, I believe it was Dr. Keshkesh that ran that study. I see Tiger
Yes.
shaking her head.
Yes, it
Yes.
was.
I meant to mention it. Yes.
Yeah. And so the
Reminding.
dosage protocol is there on ISNS. And so if you are interested or you're searching for a protocol to help guide you to reference to somebody or to take yourself, you can always go, and we've been building out those case studies. Tiana and Tiger have been working diligently also with Dr. Fadwa, and we're adding a bunch more case studies to ISNS. So keep a lookout for that, but please go and you can take a look at those case studies for the breast cancer deck that we did or that Dr. Keshkesh ran. I believe it was last year.
Yes.
I think it was 2022. And I meant to mention, thank you so much for reminding me about that because he also talks about the diet in that,
Yes.
that presentation.
Yes.
And he's very passionate about the diet in that presentation. And he also mentioned no beef, cow milk, as well as no sugars.
Yeah.
That's a great video. And we are offering a free membership for ISNS,
Hmm.
as DRC if you're interested. Maybe Tiger can put up the link for you. And it's a great opportunity to see behind the scenes of these cases. Sometimes there's pushback saying, well, do you have any clinical studies on your stuff? Like double-blind, placebo-controlled trials, right? And those take time to do, and they are in the works. But nothing is better than someone's outcome, someone's story, and especially when physicians have also been a part of this formulary and have used it on their patients. So you can see that in the ISNS platform. And Dr. Keshkesh is on there. He's just a brilliant physician. I've learned so much from him.
Well, as long as there's no other questions, we can go ahead and end the call. Thank you very much, Dr. Fadwa, Tiger, Tiana. You guys have anything? You guys good?
I'm good.
Thank you, Dr. Fadwa. That was great.
Oh, it was my pleasure. Thank you so much. It was so
Thank
much fun. I loved it.
you. Thank you so much, everyone. Have a wonderful rest of your day.
Here, bye-bye.
Bye, everybody. Create
Bye.
greatness today.